name is Mimi Roberson, and I'm the Chief Operating Officer of Well Advised. Welcome to the latest in our series about Medicare education. Today, we'll be covering a very specific part of the complex Medicare puzzle, prescription drugs. Today with me is Dr. Robert Morris, our Chief Medical Officer, and I welcome Dr. Morris to begin his presentation.
Thank you, Mimi. It's good to be here. I'm going to very briefly go through a number of different thoughts about prescription drugs. The first one is going to be a quick overview of what Medicare is and where prescription drug insurance fits into it. It will be very brief. Medicare is a very complex structure. It has a number of different parts to it, many of which I suspect people know already. But let's just deal with 5 of them. So if we could go to the first slide.
Robert, as you get started, will we have time to answer some of the questions that were sent in advance by our participants?
We should do, yes.
That would be great.
And Mimi, if I'm going too slowly, then let's try and fit them in any case.
Our goal today is to complete this webinar in 20 minutes, including answering the questions from those who have sent questions in. And if anyone has any questions during the course of this, please use the chat box and we will do our best to answer your questions. Please, Robert.
Thank you. So I put on the screen there the 5 major parts of Medicare that people have come across. Part A, Part B, Part C, Part D, and at the bottom is Medicare supplement. So let's just deal with what those are. Part A is the insurance that covers inpatient care in all sorts of forms. And that includes inpatient drugs, by the way, that most people don't realize. Part B is those medical services, your physician office visits, for instance, outpatient labs, imaging, radiology, and so on, physical therapy services that are given outside the hospital, in other words, as an outpatient. Part C, I always think of Part C as the C standing for comprehensive, because it wraps together both parts, Part A and Part B together. And it does so in a particular way that it is managed by your family or personal physician. Most Part C plans cover drugs as well. And we'll talk about that in a moment. Part D is a separate part which covers prescription drug insurance for those people who are not in Part C on the whole. And again, as always in Medicare, there are exceptions to almost every single regulation that there is. And then Medicare supplements are an additional insurance, a private insurance as well, that enables people who are only covered by Part A and Part B, which we call original Medicare. If they're only covered by that, then there's a danger that they may have excessive out-of-pocket costs. And Medicare supplement insurance makes sure that at least there is some help in that particular direction. So those are the 5 major parts that people have in Medicare. And when you join Medicare, there are essentially 2 ways that you can get care, as I just alluded to. If you just get Part A, the hospital insurance, and Part B, medical services, Medicare calls that original Medicare because that was the original plan. It does not include prescription drugs. They didn't come in until I think it was 2006. So if you're just on original Medicare, you need to add to it a prescription drug insurance, Part D, in other words. And as I've said, you also would be advised certainly by us, to obtain some insurance against your out-of-pocket costs in the form of a Medicare supplement. The other direction that you could take is to join Part C. That's a Medicare Advantage plan. One of the problems with Medicare is that there are so many names for these things, and I'm one of the people that often get them confused. So I hope I don't today. But Medicare Advantage plans, as I said, often cover your drug insurance at the same time. Not all of them do, but most of them do. And certainly the ones that we tend to recommend to people cover that as well.
So, Robert, what you're saying is more likely than not, if someone participates in a Part C plan, then they will not need the Part D prescription drug insurance.
Thank you. Yes, absolutely. Yeah. Next slide, please. So, looking at what you need, one of the questions that often comes up to us is why do I need drug insurance? I'm not on any pills. I don't expect to be on any pills. Why should I insure myself? Well, it's the same thing as if you insure your car. You don't expect to be in an accident, but you do well to get insurance in case you do have one, in case you do get a number of medications that you have to take. Medications are expensive, so it is wise to get drug insurance. It is voluntary, but having said that, if you don't get it when the government thinks you should be contributing to the overall pool of insurance, they can and very often do have a penalty for late enrollment. And that's something that we should avoid, and I'll talk about that in a moment. So we certainly think that you should get coverage as and when you need to get it. So when do I need to have it? And that is typically when you take on a Part B insurance, that is the outpatient insurance. In other words, that you have insurance that covers your visits to a physician in original Medicare. Then, and also when you get a Medicare Advantage plan, that you ought to need to make certain that you're also going to be covered by drug insurance at that point. If you're in original Medicare, you have to apply separately for a Part D, for the drug insurance. It's a private insurance, but it's not very expensive. There are something between 20 and 30 choices for every state in the union at the moment. How much would you expect to pay? On the whole, we found there's quite a variation in prices for insurance. Typically in some states at the moment, the lowest is just about below $10 a month, but you can pay much more, up to $50 or $60, depending on the state, but also depending on your specific needs and so on. The other time when you need it is not just when you first of all start off to enter Medicare, when you take a Part B. It may be that you are on a group health insurance and that is known to come to an end. So you may be 65 or older. So you may be 68, 68, and your employer says, okay, time to retire. And it's time for you to go off the group health insurance that I've been giving you and to enter Medicare proper. When you do that, Medicare allows you to take a prescription drug insurance for the first time in Medicare without a penalty. And that's an important distinction. So those two times when you are not expected to have it is immediately you join Medicare at the age of 65, or when you come off your group health insurance. Those times are the first time that you would be expected to contribute to the drug insurance pool.
Yeah, so what that means is if someone is rolling off of their employer health plan,
yep,
they are now going to be using Medicare as their primary coverage rather than the opposite. So that's when they would not have any penalties.
That is correct. And during the time that you're on a group health benefits and you're getting a drug insurance from somebody that's not Medicare, that company is, by law, has to send you, if you're over the age of 65, has to send you a little piece of paper which says, that you are on a drug plan that is essentially equivalent. We call it creditable, equivalent to Medicare insurance. And if you get that, Medicare says, okay, and then we're not expecting you to have to pay a penalty.
So make sure to hold on to that piece of paper.
Absolutely. But if you don't, then the penalties can be pretty serious. It's a complex formula that they use, but essentially what they're trying to do is to make you catch up,
right,
for the time that you haven't had it one before.
But we at Well Advised can help people navigate that process.
You took the words right out of my mouth, Mimi. Thank you.
Yeah.
So let's deal with the next slide. So what can I do, or what can you do, more to the point, to minimize the out-of-pocket drug costs that you're going to likely to have at some stage? It's worth saying really that nothing in Medicare is free. Medicare, the government that regulates Medicare expects people to share in all of the costs of Medicare somehow or other. And drugs are no different from anything else. So it's worthwhile all the time looking at what drugs are you on, and when you next go to your physician for an annual review, perhaps, to start saying to him, with your list in your hand, do I still need all these medications? Do I need the same doses, the same type of drug? Is that really necessary? And it may seem surprising that your physician may not know exactly all the drugs that you're on. It's not his or her fault. It's just that sometimes the communication between specialists doesn't really happen as well as it should.
So it's really up to the patient to make sure that the primary care physician has a complete list, because he or she may not have that from specialists. If that patient has been to a cardiologist or a rheumatologist or something, it's up to us, me as that individual, to make sure that evaluation of pharmacy is complete.
Absolutely. Absolutely. And the other question you can say is, am I actually getting the lowest cost version of these drugs? Because sometimes there are different versions of drugs from different companies and so on. And your physician should know. How would you know? Well, you can know by looking at the thing called the formulary, the drug formulary, which is a large document that's usually available for every company. They can either send it to you electronically, which is the best way of getting it, because some of them are several hundred pages long, or get your offspring, your children, to look it up for you in one of those formularies.
Well, and the important thing is, I mean, who would think that would be so complex, that one prescription versus another might be included in one of the drug plans versus another drug plan? So I think that's what we're trying to avoid here in this webinar, is sometimes these seem obvious, but they're really not obvious at all.
Absolutely, they're not obvious. And it's not obvious that all of your drugs will be covered by your plan. They may not be.
And that gets to your next point about generics.
Yes. Generics, what are generics? Well, when a drug has been researched by a company and brought to market, so to speak, they've invested a lot of money in it, and that drug, when it first comes along, is called a brand name drug, because it'll have some title that's invented by the company itself. But after a few years, that becomes the sort of copyright for that drug disappears, and other companies can make the same one without any penalties, and so we call those generics. Generics are always, with no exceptions, are always cheaper than brand name drugs. So one of the other thing you can ask your physician is, are all the drugs you're prescribing for me generics? You're prescribing the generic version of them, because I don't want to have to pay for brand names if I don't have to.
And you want to make sure that the generic is as efficacious as the original brand. And that word meaning, is it the same quality as that which you were used to getting before it became generic?
Correct. Third thing, shop around. it seems amazing, but different pharmacies may have the same drug, but at different prices. And so you want to make sure that the pharmacy you go to is in the right network, that it's not a standard network for your plan, but a preferred network for your plan. The important word there is preferred, because they will be less expensive. Fourthly, make friends with your pharmacist. Go and talk to him or her and say, you know, this is costing me a lot. Is there a better way, less expensive way that I can get this particular drug? Because often pharmacists are the ideal source of information about such things.
I have found them to always be very positive advocates for each person that they serve.
Absolutely. And do I need to say it these days in COVID? Get your prescriptions by mail order. For most people who are on a Part C, a Medicare Advantage plan, they will be less expensive by prescription. Not every.
But when you said that, let me interrupt just a minute, because you said get mail order prescriptions, but that does not mean that you can't call a pharmacist or go to the drugstore, the pharmacy, and talk to a pharmacist. They're there to serve you, whether you're buying something from them or not.
Correct. Absolutely. Thank you, Mimi. But very often companies, Part C companies, your insurance plan companies for Medicare Advantage plan will give is not the correct word, but will send you 3 months supply for a 2 months cost, because it's cheaper for them
to
send things out by mail.
Money. And oftentimes there's no shipping costs.
Yep. So let's go on to the last slide. Okay, you've done all these things and you've tried them all and they're not working as well as you would hope. So how can you get some real financial help with drug costs, which is going to be in a different way? There are two particular ways that it's worth spending a couple of minutes on. This thing called extra help, it's nearly always in capitals, is a form of service provided by Medicare in association very often with Medicaid, with Social Security services. In essence, it is help. It's not necessarily completely free drug supplies, but there is a maximum for them. When you apply for it, which you can do, you will go through a sort of test of your finances to see what your income is, and if it's below a certain amount, and also whether you've got any liquid assets, whether you've got some money in the bank, which is sitting not paying mortgage and not paying essential services, and they will count that. And below certain level, and that changes an awful lot, and it varies certainly from state to state. You may be invited to join extra help. If you are on Medicaid already and on Medicare, in other words, what we call somebody who is dually eligible for both Medicare and Medicaid, you automatically can get extra help.
Well, you just answered one of the questions that was sent in advance, Robert. The question was specifically, I'm on Medicaid. Can I get help with my drug costs?
You can indeed. And in fact, once you're on Medicaid and on Medicare, you are automatically enrolled in extra help, usually. If you're not automatically, then you have to fill in a form and apply for it. And it's a relatively easy process, and it's fairly quickly dealt with. But that is extra help. And that a lot of people get that, particularly people who, for one reason or another, are needing care in some custodial care in a nursing home or similar.
You know, Robert, that segues into another part of a question that came in, and it was about vitamins and supplements, health supplements. Are they covered or not? And I don't believe that they are in a pharmacy.
Yeah, the straight answer that I'm supposed to give you is no, then they're not covered by Medicare at all. However, some Medicare Advantage plans do as a sort of extra benefit, do give people who are enrolled with them the ability to have a spending of over-the-counter items like vitamins and Medicare supplements, medical, see, I get confused.
Like vitamins. All of us, that's why we're here, Robert.
Vitamins and supplements, in other words, mostly food supplements and so on. So it gives you maybe sort of $40–50 towards those in a year from a particular pharmacist. But there aren't many Medicare Advantage plans that do that, but some do. So generally the answer is no, you can't get those things under Medicare.
Okay, so we have 2 minutes left in your presentation, if you can possibly get through the rest.
Yep, absolutely. SPAP stands for State Pharmaceutical Assistance Program. And it's not for every state, but some states have this. It's similar to Extra Help. You have to go through, fill in a form for it, but it's organized not by Medicare, but by your state Medicaid organization or Social Security organization. And that is worth applying for if you, for some reason, you can't get Extra Help. And lastly, the last one is if you're on a very unusual drug, then it may be that the drug company themselves have programs to assist you with the cost of if it's a very expensive drug, for instance. So that was a very quick overview. But
well, I appreciate it. And it's not often we get a medical physician helping us through these issues. So we certainly appreciate it. I really do want to have one more question that was sent in because it's really important, is what is the donut hole that my friends talk about?
Yeah, well, the donut hole was a way of the Medicare doing a sort of changeover from the amount of sharing of costs that you as a patient had to do and shifting that share of cost over to the drug company themselves. And they wanted a gap in the middle between you're paying for it and the drug company paying for it. That's how I look at it. And there was a hole in the middle and people started calling it a donut hole. Donut hole has gone. It disappeared last year. And hopefully will never come back again. It was really an outrageous scheme.
That is a very positive way to end this webinar. Something very positive happened.
Absolutely.
Well, Dr. Morris, thank you for your time today. It's always a privilege to talk to you and learn more about not only this topic, but any other topics that we do every Tuesday to help educate our constituents. So if anyone has any additional questions and wants follow up, we welcome you to ask our questions on info@well-advised.com and or go on our website to get further information. We have a catalog of our educational opportunities and webinars that you can resource at any time. So thank you very much, Dr. Morris, and we look forward to seeing and hearing from people in the future. Bye-bye.
My pleasure. Bye-bye.